For ReachMD, this is Audio Abstracts. Each year in the United States, approximately 6 million pregnancies occur. Of this number, approximately 4 million result in live births, with nearly 2 million pregnancy losses. Of this latter group, 600,000 are owed to miscarriage. Chromosomal abnormalities are common causes of congenital malformation and miscarriages. Nearly half of all miscarriages are associated with abnormal karyotypes and occur during the first few weeks of life. Screening tests that have traditionally been used to identify fetal chromosomal aneuploidies include amniocentesis and chorionic villus sampling, or CVS. While they can provide a definitive diagnosis, these procedures are invasive and carry an exceedingly small but known risk of miscarriage. Evolving diagnostic tests using maternal blood samples are non-invasive and do not carry the risk of miscarriage. They are based on DNA sequencing technologies. Non-invasive cell-free DNA prenatal testing, or NIPT, is associated with nearly 100% sensitivity and specificity in the detection of trisomies 21, 18, and 13. It can be used in both pregnant patients at increased risk or normal risk of fetal aneuploidies. Recently, a study was published that demonstrated the potential role of NIPT as a means to prospectively identify occult maternal malignancies. This study, published in the July 2015 issue of the Journal of the American Medical Association, was entitled Non-Invasive Prenatal Testing and Incidental Detection of Occult Maternal Malignancies. Dr. Diana Bianchi of the Mother-Infant Research Institute at Tufts Medical Center in Boston, Massachusetts, was the lead author. The study analyzed the cases of 8 women who received NIPT and had abnormal results. Further analysis of the results demonstrated that the abnormal findings were not due to the fetuses having an abnormal karyotype, resulting in a false positive result, but were instead due to undiagnosed cancers in the mothers. The 8 cases under review came from a laboratory that had analyzed approximately 125,000 samples over a collection period of 2.5 years, derived from asymptomatic pregnant women who participated in non-invasive prenatal screening for trisomies 21, 18, and 13, and assessments of the X and Y chromosomes. A total of 3,757 cases were reported as positive for one or more aneuploidies involving chromosomes 13, 18, 21, X, and Y. From this set of samples, 10 cases of maternal cancer were identified. Detailed clinical and sequencing data were subsequently obtained in 8 cases. The researchers discovered that each of these women had an abnormal NIPT result, and that most of them had more than one chromosomal abnormality detected, a rare result. Cancer was diagnosed in these women either during pregnancy or after giving birth, at an average of 16 weeks following their initial NIPT. Based on the study results, the authors estimate there is a 20% to 44% risk of maternal cancer if multiple chromosomal abnormalities are detected. In the study report, the authors did note the following. Quote, "Until further studies are done to assess the clinical implications of discordant non-invasive prenatal screening and fetal-type karyotype results, it is not clear what, if any, follow-up clinical evaluation is appropriate." End quote. The authors conclude that understanding the relationship between aneuploidy detection on NIPT and occult maternal malignancies may explain results that are discordant with the fetal karyotype and improve maternal clinical care. The clinical importance of these findings, however, will require further research. This has been a presentation of Audio Abstracts. For more information and for reference to this study, visit ReachMD.com.